Okay, so this is a nice short webinar today, just touching on one of these slightly tricky topics, or it can be tricky topics about patch use and vivid dreams and what you do about this. And this is nothing new for you. And I know many of you will have clients that will complain that the patches have given them some pretty weird dreams. But before we get into that, I just want to touch on the basics of things that we should be doing with all medications when we're using them in our clients. So you should always be explaining how they work. And remember, with nicotine replacement therapy, these all work by providing some of the nicotine that they would have otherwise got from their cigarettes, making quitting just a little bit easier, but no magic cure. How to use them, of course, in terms of patch, you're describing where to put it, clean, dry, hairless area of skin. Doesn't really matter where on your body you put them as long as you're comfortable. Typically, people put them on in the morning and take them off the next morning, and so on and so forth. Some of you might be using an approach where you put them on before they go to bed. Sometimes that works well for some people. Others of you might be using combinations of multiple patches. We've just started our standing orders in Lakes DHB for nurses and other health professionals, which allows them to prescribe up to 3 full-strength patches for those that need it. So we're moving on with how we use nicotine replacement therapy, much more liberal than we used to be, I think. Common side effects. You all know the common side effects of the patches, and we should be just talking about these with every single client, not in an alarming way and not scaring them to death, but the whole idea of talking about common side effects is it helps set some expectations. It can allay some fears, but most of all, it's going to help with adherence to treatment. You all know when you've not talked about something and people come back and say, oh my goodness, that varenicline you gave me, it made me feel sick. So I stopped taking the medication, when actually we should have talked about feeling a little bit sick is completely normal. It should be mostly fine. So don't worry about it too much. And similarly with patches, we should be talking about redness, itchiness. Sometimes it gives you a little bit of pain. I've talked about patch arm, when you've stuck it on your arm and you've got a little bit of an ache there. And vivid dreams is one of the things too that you should mention, because vivid dreams does seem to be one of these funny side effects of patches. But in the majority of cases, it's not a problem. And most people don't report nightmares, just some vivid dreams.
Oh, how you doing?
Before we go on to that, yes.
Out of every 100 people who use patches, is there any data being done about how many of those will experience vivid dreams as a side effect of patch use?
Yes, I'll come on to that in a minute, Grant. Okay. So I'll show you some data. Okay, but just to put something else aside here, remember about sleep disturbance, and we've had a webinar on this, I think last year, about sleep disturbance also occurring in people that are stopping smoking. But this really seems to be a withdrawal symptom, more importantly here. So remembering that with sleep disturbance, you get the sleep fragmentation, you kind of wake up more during the night, but most of these sleeping patterns are going to return to normal within 3 to 4 weeks. So this does occur. It is a bit of a pain when people are stopping smoking, and especially if you're having to concentrate at work the next day. But this is most likely a withdrawal symptom. Now, here's some data. Now, I've taken, I'll just spend a little bit of time on this slide, and these data are from the EAGLE study. Now, you might remember the EAGLE study was a study to determine whether varenicline caused adverse psychiatric events. You remember the days when people taking varenicline were afraid that it might cause depression or suicide ideation. And this study, which was a very large study of around 1,000 people here that were randomly allocated to either varenicline, bupropion, a 21 milligram 24-hour patch, or placebo. And this was a triple dummy design, remember. So if you were in the placebo arm, you got placebo varenicline, placebo bupropion, and a placebo patch. So you had to take all 3 of those placebo tablets. And this is really the only way to truly tease out what might be going on here. Now, I've just pinched part of a table in this study, which looks separately at those smokers that did not have a psychiatric history, so had no psychiatric diagnoses, that's on the left-hand side here, versus those that did. And now I've just pulled out abnormal dreams and sleep disorder. So I'm just going to look at those 2. Now, if we just start with abnormal dreams, here you can see the proportion of people that experienced abnormal dreams in those taking varenicline versus those taking bupropion, nicotine patch, and placebo. So if you just looked at that cohort and the non-psychiatric cohort, would you agree that it appears that nicotine patch and varenicline would be likely to be associated with abnormal dreams? And I hope you can see here that placebo was 4%. So there's some there that sort of, regardless of what you're on, you have abnormal dreams. But when you've got, more than a doubling in the incidence of this here, I think you can fairly say that yes, nicotine patch and varenicline are associated with abnormal dreams. And abnormal dreams could just be vivid dreams. You really remember the dreams. They've just all been put into one category. So Grant, in answer to your question before, around 10%, around, 11 in every 100 in this particular study reported abnormal dreams whilst using a nicotine patch.
And it's important to remember that too, isn't it? You said before that that's not necessarily nightmares. It's not scaring them. It's just dreams.
Yep, absolutely. And I think probably, I know I'm sometimes guilty of this, that I probably am more likely to warn people on varenicline about abnormal dreams than I am to just let people know on patches that they might get some strange or vivid dreams, but not to worry about it. Most people don't find these problematic.
So when you're telling someone who's on varenicline, which has a rare side effect of abnormal dreams, you wouldn't say to them, if you experience abnormal dreams taking this medicine, i.e. varenicline, you must come off it straight away.
Absolutely not. I would not say that at all, Grant. This is about saying up front, hey, look, some people in this case, 8 out of every 100 people experience some abnormal dreams, or I wouldn't say abnormal dreams, I'd say vivid dreams, because that's typically what they are. But the message should be, but don't worry, most people don't find these problematic, but let me know if they are. So you wouldn't say, if you get it, stop it. Just like we don't say with other medicines that are important, unless they're life-threatening, most people can put up with some of those mild side effects.
And of course, you would say the same about patches then. If you experience vivid dreams, just tell me about it. And okay.
Absolutely. Now, if you look at on this people with a psychiatric history, you can see here that they were just slightly more likely to report these abnormal dreams. So you saw that in the study with a whole lot of these side effects. Okay, so you might have those with a history of schizophrenia or depression or anything. They might be a little bit more likely to report abnormal dreams, but not hugely. 14% versus 11%. Now, sleep disorder, just something a little bit different here. You'll notice that the proportion of people with sleep disorder, 3, 4, 2, 2, 3, 4, 3, 2, all pretty similar, right? Which suggests that it's not a medication effect that's causing the sleep problems. Because if it was a medication effect, you'd expect the proportion of people on active medication to have much higher rates of sleep disorder, but it's not. So what does that suggest? It suggests that it's a withdrawal effect as opposed to a medication effect here.
So a withdrawal symptom of stopping using tobacco.
Yeah, exactly. Yeah. Okay, so hopefully that gives you a little bit of an idea there. Now, there have been some studies that have looked more specifically at what's going on in dreams. And this was a crossover study published a few years ago now, but they looked at people using a nicotine patch versus using a placebo patch. And what they found in particular during REM sleep, rapid eye movement sleep, if you're wearing a nicotine patch, you are more likely to report more of your dreams with visual imagery. So you'd say, oh, I saw this in my dream, or I remember this happening. So significantly more likely to report sort of this visual imagery, and more likely to report dreams being more vivid. So they see all this imagery and it's really vivid to them. So that's occurring in REM sleep. So there seems to be some specific time points of the sleep cycle, and specifically about visual imagery and dreams being more vivid. Now, why the dreams? Well, actually, no one really knows. And I had a look at this week. I went back through the literature, and it's pretty scarce. So the best that I could see was that it's probably a cholinergic effect. And just remember, nicotine acts on nicotinic acetylcholine receptors. So activating this cholinergic system might give rise to these dreams. And it's thought that perhaps the nicotine might result in these sort of micro or mini arousals during the night. So instead of sleeping solidly, you've got all these little points where you're just waking up. And although you don't remember them, it allows for a level of consciousness to exist in your dreaming. So essentially, you're more likely to remember your dreams. So that's possibly how this all works. But to be honest, I can't find anything absolutely clear cut. And animal data seems to differ from human data. So who knows? It's a complex area. But know that it does happen. It's probably an effect of nicotine in some way, but no one quite knows exactly how.
Why is it it's not occurring with people who are on 4 milligram gum, for instance? It seems to be a patch side effect.
Yeah, it's mostly because you're getting that continuous supply of nicotine throughout the night when you're wearing a patch.
Yeah.
Yeah. So, and remember, you know, the half-life of nicotine is only 90 minutes. So you get rid of it pretty quickly. So within an hour and a half, you get rid of half the nicotine in your body. So if you're on gum, you know, it goes down pretty quickly. On patch, it stays up higher for some period of time. So just to summarize all of the data that we do have, patch use, nicotine patch use overnight can result in some fragmented sleep, can result in less REM sleep.
What can you explain what REM sleep is?
It's rapid eye movement sleep. It's a phase of sleep pattern where we tend to do a lot of dreaming, but it's also when a lot of the recovery happens too for our body. So it's just a stage of sleep, and it's an important stage of sleep. So if your REM sleep's disrupted, you tend to be pretty tired in the morning. And also what you get with, as I've mentioned, with patches is that you get, and this is quite nice how they explained this, was increased REM dream quality. So I don't know, can you say to people, hey, you might have improved dream quality with all of this? And remember, that's not all nightmares. Some people come back and say, I love my dreams. So there might be a positive side effect out of all of this anyway. So really important not to just tell people to stop wearing their patches if they get vivid dreams. But like all medication, explain the common side effects, because knowing what to expect can really help with adherence to treatment. You know what this is like, even if yourself, if someone's explained to you a medicine and the side effects and you get a side effect, you know what to do about it or not to be worried about it, depending on what that side effect is. And as Grant's already mentioned and we've stressed, people don't have to stop wearing the patch or stop taking varenicline if they experience vivid dreams. But if this affects them, you know, they're having terrible nightmares or they're worried that they're going to go and sleepwalk or sleep drive or something awful, then you should offer some solutions. And one of the most simple solutions would be just to remove the patch before they go to bed. And I think that was that nice short webinar on vivid dreams and patches.
Thank you. I had vivid dreams when I was quitting smoking years and years ago with patch use, and that was a long time before there were stop smoking practitioners around, and I finally figured it out. And in the interests of science, over the last 3 nights, I've been putting a 21 milligram patch on in the morning and leaving it on for 24 hours. And I experienced vivid dreams all night for 3 nights. It's quite amazing.
Yeah, there you go. So thanks, Grant. You've sort of solved any questions that people might have. So patches do or can cause vivid dreams, not in everyone. So do talk about them, but reassure people. Grant, you obviously survived your vivid dreams without too much trauma.
Oh, quite. Some of them were very amazing. It was like going to IMAX theatre in Auckland. It was good. I liked it.
So there you go. Have those discussions with clients and just, you know, reassure them that these are common. I know 11% may not seem like that's common, but in side effect terminology, that's common. So I would say that was a common side effect.
Because you really want people to have their patches on 24 hours a day for at least 8 weeks, eh?
We absolutely do.
You don't want them prescribing and taking them off because they had a dream at night.
Absolutely.
Okay.
There we go. Any questions?
So people can unmute themselves and ask a question if you have a question of Hayden.
Yeah, or use the chat function.
No, it doesn't look like it. Looks like you've done a great webinar.
Great. And look, we always like topics or suggestions. So if you've got something you want to ask, and it might be just as simple as this, you know, what is the evidence for vivid dreams, or how do I do this, or what should I say about this, then let us know, because this is, you know, it's quite good. Otherwise you just get more of what Grant wants me to talk about. So, you know, getting some ideas would be great. I don't know, perhaps something that you might want to hear next time about is COVID and smoking. I know there's been a little bit of confusion out there as to whether nicotine might be protective against the SARS-CoV-2 virus, or whether, you know, where does smoking fit in with all of this? So that's useful. Maybe we can discuss that next time.
Can you hear me?
Yeah, I can hear you, Tony.
Oh, yeah. Just an interesting article I read in a British newspaper saying that 1 million Britons had quit during the COVID lockdown or during the COVID crisis. Do you think that's something that could possibly be representative of New Zealand as well? I thought it would go the other way.
I think that actually during COVID, it was a time when smokers were quite anxious. And we know that if you do, you know, it's particularly important for the smokers with smoking related illness already to stay well and to ideally quit. So I think during COVID, it was a time that many people were looking at changing their health behavior just because they were so worried about it. And I think when we get the next wave, if we get the next wave, I think perhaps when we get the next wave, again, we should be thinking about how we continue to operate over that period without sort of shutting ourselves away. And I think we're more prepared next time round for using some of the technology that we've got in place to make sure that we can support people wherever they are.
Yeah, because I mean, the silver lining out of that might have been the behaviour around quitting smoking, for example. And then that's had the flow-on effect through all the hospitals, you know, people with respiratory conditions, flus, getting sick. You know, it's a lot less on the healthcare system.
Yeah, absolutely. Yeah. So yeah, maybe a good thing just to keep in mind. Now, just a couple of questions that have come through. Is there any danger in putting a patch over the heart? No, there's not. It's a bit of an urban myth, actually, that, you know, don't put a patch directly over your heart. The nicotine's just absorbed into the small blood vessels under the skin, which will drain back into the main venous supply. So it's not like there's any instant nicotine hit going to the heart. In fact, the fastest way of getting nicotine to the heart is to smoke, because that goes straight from your lungs to the pulmonary circulation, straight to the heart. So that's a much better way of getting more nicotine to your heart. And it's not really the nicotine that's the dangerous part either. It's the other substances and tobacco smoke that are more likely to cause the problems. And just another one, is sleep disturbance a withdrawal symptom of no carbon monoxide? No, it's just part of a withdrawal syndrome from tobacco. Part of it will be nicotine, but there are other things in tobacco as well. But not specifically carbon monoxide that I know of. Good questions. And if there's nothing else, we'll see you next month.
There's one more question just come in via chat.
Increase in nicotine dose correlated to increase in intensity of dreams. Amy, possibly in some people. They have found that in animal studies where they dosed up cats, poor cats, and looking at electrical activity in their brain, and they did show that the increasing dose was related to increased intensity of these changes in sleeping patterns. But that may not necessarily translate to humans. I don't know, ask people if you've got them on a higher dose or if you're stepping them up on nicotine, ask them if that made any changes.
Okay. All right. Well, thank you very much, Hayden. That was great. Just a reminder to everyone, this is being recorded. So if you've got colleagues or other people who you think might be interested to view this, it'll be up on our NTS website, most likely tomorrow. So people will be able to view it then on our homepage of our website. You'll see clinical webinars. They can hit on this and watch it. All right, over to you, Hayden.
Well, that's it from me. Thanks very much. And yeah, get your questions or any suggestions for what next to Grant, and he'll chase me up and make sure that I do something on time.